Hi, this is Jack Hartley. I'm the owner of Homestead Senior Care, Valdosta, Thomasville, and Tifton, and today I'm going to talk to you about a subject that's needs to be discussed as we age, and it's called colorectal cancer. If you're over the age of 50, you should have been screened or should be screened for colorectal cancer. So what is colorectal cancer? Well, it occurs in the colon or the rectum. Sometimes it's just called colon cancer, even though it may occur in the rectum. The rectum is the passageway that connects the colon to the anus. So who can get colon cancer? Both men and women, but most often it's found in people over 50, and your risk does increase with age. Screening, what a screening is to look for precancerous polyps and early stage colorectal cancer, because early stages it may not cause any type of symptoms, especially at first. You could have early stage colon cancer and not even know it. So getting a screening done is highly important to do after age 50. Who is at a higher risk? You or a close relative have had colorectal polyps or colorectal cancer. You have an inflammatory bowel disease like Crohn's disease or ulcerative colitis. You have a genetic marker in your system, or you have hereditary colorectal cancer. Someone in your immediate family or even your aunts, uncles, grandparents have had colorectal cancer. What are the symptoms? One of the symptoms is blood in your stool or in your bowel movement, stomach pain, aches, cramps, and things that don't go away, losing weight and you don't know why. See a doctor if you have any of these. They may be caused by something else, but you want to be safe and make sure you get tested as soon as possible. So what are the types of tests? There's one that's called a stool test at home, and this is returned to the lab, and it can be done every year. It's ordered by your doctor. There's one called the fecal immunochemical test, or FIT. It's a test kit provided by the doctor or the lab, and that's once a year as well. There's a FIT DNA test, and it combines the FIT with a test to detect DNA in the stool. You collect the entire bowel movement, and you can do that every 3 years. There's a flexible sigmoidoscopy, and this is a short, thin, flexible, lighted tube inserted into your rectum. The doctor checks for polyps or cancer inside the rectum and the lower third of the colon, and this can be done every 5 or 10 years. Colonostomy is what most people are familiar with. It's similar to the sigmoidoscopy, but the doctor uses a thin, flexible, lighted tube to catch for polyps or cancer inside the rectum and the entire colon. During this test, the doctor can find and remove most polyps and some cancers. In most cases, you are asleep during this procedure. Generally, this is only done every 10 years. And then the last one is called a CT colography, or visual colonoscopy. This uses x-rays and computers to produce images of the entire colon. These images are displayed on a computer screen so the doctor can analyze them. So if you're 50 or older, talk with your doctor about getting screened. If caught early, your chances of survival increase dramatically. If you want to give me a call, my number is 229-563-5123, or you can reach me at jack.hartley@homestead.com. Thanks.